All right, Avik Roy is Senior Fellow at the Manhattan Institute. He is joining us live from New York this morning. Thanks for joining us today, Avik. What happens if everyone who wants to sign up for affordable health care, for Obamacare, if they can't get through, if they just can't get the coverage that they want to get? How damaging is that for the overall program?
Good morning, Lisa. Well, what's going to happen is there are going to be dislocations and disruptions because the payment systems that need to be built in order for consumers to actually pay insurers for these new subsidized health plans, those haven't been built yet or they haven't been completed yet. So even though people are selecting plans on these websites sponsored by the government, they're not officially enrolled in health insurance plans until they've actually paid the insurers, and there's a lot of problems with that last step.
Okay, so is it safe to say, I mean, what's your opinion, is affordable care on track?
Well, no, because unfortunately there are going to be these dislocations. A lot of the old plans that people were on are now illegal due to new regulations under the Affordable Care Act, and only a fraction of those people have now been able to sign up for new plans, which is why the administration is changing a number of the rules in order to accommodate those individuals. But there still are going to be gaps. We'll probably enter the new year with actually less Americans with health insurance than a month before or 2 months before.
Certainly has not been an easy rollout. So the program needs a diverse mix of people signing up. You need healthy folks to pay for the people who are submitting claims because they've been sick. To your knowledge, is that happening? And what happens if you don't get just the right mix of people signing up?
So the plans that the insurers have offered on these exchanges are based on the assumption that both young and healthy people and older and sicker people all are in the same risk pool, because that way it averages out in a reasonable way. Unfortunately, most of the indications we have thus far is it's mostly older and sicker people who are signing up, because the way the exchanges are structured, those people get a much better deal for their insurance, whereas younger and healthy people are going to have to pay a lot more for their insurance, so they're staying away, at least in the near term.
Avik, this is supposed to be Barack Obama's biggest legislative accomplishment. Do you think he's going to be able to pull it off?
Hopefully over time things will even out, but at least in the first year it looks like it's going to continue to be rocky, which is going to be important into the 2014 midterm elections, because we're likely to see costs go up for these insurance plans, not down. And of course the law is called the Affordable Care Act. It's supposed to make health insurance more affordable, but a lot of Americans are going to see their health insurance bills go up, unfortunately.
Okay, well, thanks for joining us today. Merry Christmas. Avik Roy there from the Manhattan Institute, joining us from New York.